Welcome to Health Matters, the Aspen Medical Podcast. I'm your host again. My name is Eamonn Quinn. I don't know why I said I'm the host again. I just seem to be the host, but because I'm doing quite a few of these, I've said the host again. My name is Eamonn, as I've said, and I'm working in the Aspen Medical Marketing and Communications Department. I'm joined by my colleague, the Group Medical Director of Aspen Medical, Dr. Andrew Jeremijenko. Andrew, good afternoon.
Good afternoon.
Let's hope people are listening to this podcast in the afternoon, because it will sound a little bit silly if they're listening to it on the way home in the evening at 8 o'clock. But anyway, Dr. Jeremijenko, I first met him a couple of weeks ago when he joined Aspen Medical, and I was deeply impressed by the fact that he was the only person I ever knew who'd actually had something published anywhere on the planet whatsoever. It happened to be a rather important piece of work as well. It was about the waning efficacy of a particular vaccine in fighting COVID-19. This is not, I'm not going to, product placement is fine. We're actually talking about a particular mRNA vaccine, and if Andrew wants to mention it, that's fine. But we will get to that. And the important thing was, it was about booster shots, and it was about the fact that if we didn't do something, then quite simply there would be more trouble ahead for Australia and the globe. Andrew's work appeared in the New England Medical Journal, or the Medical Journal of New England, along with several co-authors, and is based on his time prior to just joining Aspen Medical when Andrew was in Qatar. So that's the context. Andrew, I'm just going to hand really this over to you, because it is very, very topical. Today is the 27th of October, and the TGA has approved booster shots for Pfizer in Australia, which is good news, we believe. Andrew, what is the waning efficacy all about, and tell us why we need those booster shots?
Yeah, well, look, you're right, and thank you. We were studying this in Qatar, and we have a great database over there. Lots of people, millions of people who were vaccinated. We were able to see that over 6 months, the vaccine efficacy, so how many infections were stopped by the vaccine, it really started to fall off, particularly at 7 months. Now, the good news is that you didn't get severe disease when you were vaccinated, but you could get a milder symptom, and particularly around about 6 months, and you could actually spread it as well. So we saw in other countries like Israel, when they opened up, a really big wave, even though they'd had 80% of their people vaccinated by Pfizer or mRNA vaccines. And that was because of that waning immunity. So with Australia already planning to open up, Queensland hasn't, maybe December 17th, we really want to make sure our immunity is good. So we stopped that surge that we saw in England after Freedom Day, in Israel when they opened up. It's about trying to control this virus and stop it from getting to those sick people who will actually die from it.
It's interesting, because I do recall, a lot of the poster, I'm going to call them poster boys, that's somewhat sexist, but okay, poster people. The poster people for vaccines were in fact Israel, and I think it's the rest of the world is watching. We always go back and we think this is years old. This is only months ago, right? So when Israel got well ahead of the game, so to speak, and they vaccinated so many of their people. But it isn't that long ago that, as you rightly point out, we began to hear, reading on the news and seeing on the news or whatever, that there was beginning to be another wave, even though, and people's going, oh no, this will never end, because the Israelis have got so many people vaccinated, this thing doesn't seem to ever want to stop. But that was the reason, right? It was just that waning efficacy that was happening in the background, because, this might sound obvious, but to the layperson like me, this has only been going on 18 months. This virus has been around millions of years, and we've only seen it for 18 months. So we're really flying this plane as we're going along, right? We're making the plane as we're flying it to an extent.
That's right. And it is true. I think what we saw in Israel, even though they had that second wave and there was lots of reports about it, they didn't actually have many deaths. It was a lot lower because the Pfizer was still protecting you from severe disease. But it actually did cause quite a significant number of cases. And when they vaccinated, again, they stopped it. So vaccines really do work. And that's the great news. And probably we don't need another booster shot after the 6-month shot. That's probably going to last us for years. You might have to get in the flu vaccines, you have to change the vaccine a little bit. So every year they change the flu vaccine to match the flu seasons that are going around. Now, potentially that might happen with COVID. We think with 2 shots, say the Pfizer vaccine, that's 2 shots 3 weeks apart, and then one shot at 6 months, then you're going to be good against the virus. And, when I was studying in Qatar, we had these poor people who lived 8 to a room, and they were coughed on and everything like that. And we vaccinated a lot of those people. They still got coughed on. They still basically were getting exposed to the coronavirus, the COVID-19, but they didn't get sick, and it just boosted their immunity. I mean, basically, coughing on a person who's vaccinated, you get a mild illness, but it'll boost your immunity. It's almost like getting a booster shot. But it's much better to get a booster shot and not spread it to your mum or your grandmother who potentially might die from this disease.
Can I ask, Andrew, I mean, for those, Qatar is where the next World Cup is going to take place. These guys are they're a huge amount of people working on building stadiums and so on. So they had a vested interest really in trying to get vaccinated as soon as possible. Just to give it some context, this is one of the world's most, so your research is based on one of the world's most vaccinated countries, right? We're not talking about 50% here. We're talking about way out there.
Well over 80%. And the interesting thing about Qatar and why it didn't get the surge that Israel got, basically many of those poor people that I was talking about, the workers, they got infected in the first wave. And then in the second wave, there were a lot of people in the city that got infected. So they probably had about 70% of their population infected through the first and second wave. And then when the vaccines came, we protected all the older people and health workers. And so we had really quite low death rate. Normal death rate in the world is about 2%. And our death rate in Qatar was 0.2%, so a tenth of the normal death rate. And Australia's the same, Australia's actually has got a very low death rate population-wise compared to the rest of the world. Like the US has about 100 times more death per capita than Australia does. And I think amongst all those the bad news and arguments about vaccinations and quarantine, that sometimes people don't understand how well Australia has done. Australia and Qatar both did amazing jobs. Now, back to the Qatar story. Sorry, I diverged. Qatar had 70% of people infected, and then they had 80% of people vaccinated, and more than 80% now. So they've got really strong immunity, and we haven't seen a second wave, a third wave come back, because they've got both natural immunity and the vaccination immunity in many of their people, and now they've also given booster shots as well. So I think that Qatar is safe for the World Cup, and I hope to get over there and support Australia. But no, it's great. And they've done a great job in making their country as safe as possible for the World Cup. And Australia's doing the same thing. If Australia can get vaccinated and open up and use these boosters, we will have one of the lowest death rates in the world. We will be one of the most successful countries in the world when it comes to controlling COVID. And you really have to give it out to the public health physicians. I mean, they deserve medals. They've really helped control. I know it was a pain with all those lockdowns, but to have such a low death rate, 100 times less than the US and 90 times less than the UK, I mean, that's an amazing achievement. And then for everybody to roll up their sleeves and go and get vaccinated is even better. Now all we're doing is just saying, let's be double sure, get a booster, and we'll be right. We'll be having the Australian Open and the Grand Prix and all our great sporting events and concerts and everything again, because we will have immunity, herd immunity. That is exciting. I mean, I think, and you've touched on it. I clearly wasn't born and bred in Melbourne or anywhere like that. I'm Irish, and I have a very personal relationship with COVID, and I often would say to colleagues and people in the media that you have got to give Australia and Australians and our system the kudos it deserves, because there's very few Australians who know somebody who's either had COVID or certainly who's passed away from COVID. And I would always open up with that, with that kind of statement to people, and this is kind of personal, but and then they'd say, no, I don't. And I said, well, you do now, because my mother passed away in Ireland of COVID-related complications. She was 90. She had a list of comorbidities that looked like a shopping list for Coles. It was that long, but it was COVID that eventually got her. And that's in a modern European capital city where she had been double vaxxed, and still the virus got into the major hospital over there, the major public hospital, and unfortunately took her away, along with many, many, many others. And I think that's, the lesson there is not about me, it's about what we've done in Australia, because we still, despite the loss of life, which is dreadful, there's still
we got to give ourselves a clap on the back for what we've done. And as you rightly point out, the boosters, that's the finishing line, really. Is that how public physicians are seeing it, Andrew? Is the boosters, is that the cherry on the top of the cake? Is that the finishing line for us? Do you think?
Yeah, if we hit 80-90%, I would say. Now, there are problems. Obviously, Papua New Guinea has a wave at the moment, and many places, poor places in the world, haven't been vaccinated. And that's where the mutations can occur. And that's when we might need another vaccine if something mutates to a great enough extent to be able to infect. But I'm hoping that it's over. I told Qatar it was over once they hit that high vaccination rate, because I knew they had that high natural infection rate and the high vaccination rate. They were good. I came home to Australia. I said, "You're good now." But you're right, Eamonn. The places like Ireland and England and Italy, I mean, we saw doctors dying and nurses dying, and Australia has not had that issue. So when we talk about booster shots, I think immunosuppressed people, they're already approved for booster shots. I think we're going to have everybody over 18 approved for booster shots, and the healthcare workers really need to get in there and get their booster shots. And then obviously, I don't know why, but I was talking to someone recently about the resource industry in central Queensland, and there's a lot of guys out there who may have had some misinformation, and they've got low vaccination rates in the resource industry, say the coal mines in central Queensland. And I just want to say, this virus is really infectious. In Qatar, you had two choices. You either got vaccinated or you got the Delta virus, because that's just the way it was. And we've seen this young guy in Queensland, dying. We've seen lots of young people die from this disease. Unfortunately, it does get the young people as well as the old. Higher rates in the old people, but young people can still die. It just seems like some people are susceptible and they die. And the guys that we've seen on TV have been quite fit, go to the gym, all that sort of stuff, and they've died just because they didn't get vaccinated. And the other thing, some of those shocks that are anti-vaxxers, there's actually a site now that has recorded how many of those people have actually died. They've been giving out this message to not get vaccinated, and they've actually got COVID themselves and died. And I read that at least 6 of those people have died. So, it's a dangerous sort of philosophy to be spreading and to believe in yourself, because it does actually kill people.
Can I ask, Andrew, just doing the math on the back of an envelope, so to speak, I mean, there are 20 million Australians over 18. So if we vaccinate 90% of those, I'm going to try and do my math, so correct me if I'm wrong, but that leaves does that leave roughly 2 million people? 2 million people who will be unvaccinated for whatever reason. Maybe they can't get vaccinated, because we know there are people in that group as well. Are we saying potentially that the coronavirus, once we open up and we say, well, that's it, is there potential for this virus or variants to just rip through the entire unvaccinated? That's a lot of people. That's 2 million people at risk, right?
That's right. And my personal belief is Delta virus will find them. If you're unvaccinated, Delta virus is going to find it. So 2 million people, and about 1% of those people will die. So that's, divide by 100, that's 20,000 people.
Yeah.
Is that right?
That's right. Yeah. No. That's absolutely right. Right. Unfortunately, you're absolutely right.
That's right. And that's a lot of deaths and a lot of preventable deaths. And so to me, it doesn't make sense that people don't get vaccinated. The statistics are so clear. I know that people I used to work in Qatar, and a lot of the nurses didn't want to get vaccinated because of fertility issues. They said, I want to have a baby. And it doesn't affect it. And all those nurses came back with COVID.
Yeah.
So it was a real shame. I tried to convince them to get vaccinated. They said, no, I want to fall pregnant. And they didn't fall pregnant, but they got COVID.
So there we have it. I mean, Andrew, you've worked in one of the world's most vaccinated countries. You've been at the epicenter of this pandemic. You have seen how it works. You've seen this virus close up. You've seen it firsthand. You've seen how the vaccines work. I mean, it really is a simple message to people. It's know the facts, get the vax. That's what's going to save lives going forward after we open up. And I think some people are commentators and they give their, but you're genuinely someone who has worked right in the epicenter of this. So when you say it, people should really take notice of it. Get your shots, and get your booster. Right?
That's right.
It's that simple.
One of the scenes I'm going to take away from Qatar is going into a morgue and seeing all these young people, because they're mainly young workers, dead and alone in the morgue. Just no family, just lying there, and it was a tragedy. It was a real tragedy. So I want to prevent that. Yeah. And all you got to do is get vaccinated. It really does work. And now you can get the booster too. Be double sure.
Dr. Andrew Jeremijenko, again, thank you so much for your time and sharing your stories, your insights and your expertise with us here on Aspen Medical's Health Matters. Thanks so much.